Depression is more than just sadness. It's a medical condition and is treatable as well as preventable. It's important to recognize the signs of depression in yourself as well as in your loved ones. The symptoms of depression can vary, but mostly it includes persistent sadness as well as changes in appetite and sleeping patterns. You may also have a lack of interest in activities that you previously found enjoyable. If you suspect that someone you care about is struggling with depression, it's important for you to reach out and show them that you care. Encourage them to seek professional help. Therapy, medication, or a combination of both can be effective in the treatment of depression. Additionally, lifestyle changes such as exercising regularly, healthy diet, and stress reduction techniques like breathing exercises can be effective in managing the symptoms of depression. Remember that depression is not just sadness, it's a medical condition that deserves understanding and proper treatment. And we at Kenyatta University Teaching and Referral Hospital are ready to assist you. Together we can break the stigma and raise awareness on mental health.
So thank you for the opportunity. Dr. Muia Janet, consultant psychiatrist at Kenyatta University Teaching, Referral and Research Hospital. I've been a psychiatrist now for a period of 5 years, but I've been a doctor for more than 10 years. That's a very important question. So mental health is such an integral part of our health and well-being. It guides how we think, how we feel, how we act. It's beyond the mental health disorders. Probably if I would use the World Health Organization definition so that it gives us a clearer understanding of the same. So mental health is the state in which an individual is able to use their abilities, is able to cope with life stresses, is able to be productive and fruitful in whatever it is they do in terms of their work. They're able to make a difference in the community. From that definition, it shows you it's never a constant, so it keeps varying through the various seasons of an individual's life. So it essentially exists as a continuum, not as a fixed state. And it's important for all the ages, from childhood into adolescence, into adulthood, even into the golden years for the elderly. So we need to think about our mental health cutting across all the ages. Probably I start by defining what mental health illnesses or conditions or problems are. These are when an individual has a significant disturbance in the way they are thinking, in their emotional regulation, in how they are behaving, which significantly affects the various areas of their functioning, in that they'll struggle in socializing, at work, in their family. It will affect how they conduct their career, their occupation. So when this is significant is when we say someone has a mental health illness or a mental health problem. So the cause of mental health illnesses it's an interplay of many factors. There's no one cause we can say this is the reason why someone has mental health issues. So one of the major factors are biological. Does an individual have a genetic predisposition to mental illness? Do they have someone in their family who struggled with mental illness? Do they have a chemical imbalance in the brain? Do they have a pre-existing condition that would predispose them to mental illness? Are they using substances, psychoactive substances, which would predispose them to this? Socially, we are looking at, do they have life traumas, life-changing experiences? Do they have adverse childhood traumas? Do they have a social capital? social support. We say we are social beings. Are they backed up in terms of social capital? Psychologically, what are the coping mechanisms? Do you have resilience? Are you able to bounce back from a hard situation? So it's an interplay of all these factors which would lead one to present with a mental illness. In Kenya, we say 1 in 4 of Kenyans have mental health illness. It's interesting. There's a study done in 2011 where they went to a general clinic hospital and did study and found 25% of the patients who had gone to seek help for other medical condition, not a psychiatric hospital, had mental illness, and 40% of those in the inpatient admitted for other reason actually had mental illness. That gives you a glimpse of the prevalence and how common it is and how often it goes undiagnosed. So for the children, we get to see the neurodevelopmental conditions. We've heard of attention deficit hyperactive disorder, commonly said as ADHD. We have autism spectrum disorder, which affects starts at the developmental period. Moving to the teenagehood, we now see the mood disorders where there is lability of mood, what it is described as bipolar mood disorder, individuals going through depressive episodes, individuals having excessive fear and worry, what we describe as anxiety disorders. We also have various addictions. We have addictions to alcohol, addictions to other substances like cannabis, even prescription drugs. Individual can be addicted to that. We have gambling. Moving to the elderly, the individuals in the golden ages, we are looking at dementia, where there is the progressive memory loss associated with personality change. So this is a glimpse of the wide range of the mental health illnesses. KUTRRH, we have a mental health department comprising of different personnel. So we have the medical doctors, we have the psychiatrists, we have the counselors who are able to offer the social support. We also work in collaboration with the other departments, the social work department, to bring in the aspect of the home environment. We also look at our patient in a holistic way. So if an individual has other medical conditions, we are able to consult the other disciplines so that you're able to get a comprehensive care from our facility. And we are looking into all the aspects, just empowering our patients to ways of preventing mental illness, to how to promote mental illness so that you don't get the relapses, and the curative aspect for those who come already with mental health issues. Yes. For mental health, we have to look at it from all aspects, for the individual, for the family, for the community, and even at the policy level. So every individual needs to be very intentional about their mental health. We are talking about self-care. How aware are you and how intentional are you to ensure your mental health is well taken care of? At the family level, are we able to support our family members who are struggling with mental health issues, being that pillar, that social support, which is very key to the outcome of the individual, being able to consider it as a medical condition and break the discrimination and the stigma. The same applies at the society and the community. Are we able to embrace individuals who are struggling with mental illness and provide opportunities for them to get help and to get employment and all these aspects? And also, as a country, we are in a better space in terms of policy. We are now seeing more policies and conversations around mental health, which is definitely a step forward compared to before.
Right. Dr. Muia, your final comments on mental health?
I would say it's okay not to be okay. Help is available. You just need to speak up, and we all need to be very intentional about our mental health. Yes, thank you.